All right, Cameron, start reading the passage. And as you're reading, I'm going to just mark some things as you go. Okay?
Sports injuries are painful. They are also a part of life for most athletes. Even for young amateur athletes who play sports as part of an extracurricular programs at school. Teenagers who play sports regularly can suffer nearly the same number of sports-related injuries as professional athletes. Teenagers are also still growing, so they're more vulnerable to certain types of sports injuries. Fortunately, for most common sports injuries, they're usually not serious and are relatively easy to treat.
So I'm just going to stop you, Cameron. What do you think that word, where it says teenagers are also still growing, so they are more vulnerable? What do you think that means? Okay, excellent. So the first passage, what do you think what is it saying so far? What's the whole main idea here?
It's talking about sports injuries.
And what about sports injuries?
That people, even if they don't play professional sports, can still get hurt.
All right, excellent. Let's keep going.
Types of injuries. Many sports injuries are acute, which means they occur suddenly during an activity. Other injuries are chronic or reoccurring and are often caused by repetitive activities that overwork muscles and tendons. A fracture affects a bone and it is a break of any size. Finger fractures are among the most common sports-related injuries. Shin splints, a common chronic injury for runners, are a kind of stress fracture.
So what do you think about that word, or is this a chronic injury? Have you ever heard of shin splints before? Mm-hmm. So if it's a chronic injury,
it means that it, I think it doesn't just go away.
Yeah, yeah, it's excellent. All right, let's keep going.
Sprains and strains are two common injuries that sound alike. To an athlete, suffering a sprain or strain, the pain may feel very similar. But the two are actually very different. A strain is a stretch or tear in a muscle or tendon. In contrast, a sprain occurs when a ligament stretches or tears. Ankles, wrists, and knees are the most commonly sprained parts of the body. A concussion is another common sports-related injury. A concussion is caused by a blow to the head that shakes the brain inside the skull. Symptoms may include losing consciousness for a short time immediately after the injury, followed by seeing stars, dizziness, nausea, headaches, confusion, and inability to focus.
Doing great.
Treatment. Sprains and strains are soft tissue injuries. Applying an ice pack to a sprain or strain immediately after the injury occurs can help reduce swelling. So can using compression wraps. Some soft tissue injuries benefit from gentle exercise or movement and heal more quickly and fully that way. Soft tissue injuries are treated differently from the bone fractures. A broken bone is usually set in place and immobilized so it heals properly.
You know what that word means? Immobilized. It's a broken bone. What do you usually want to do with a broken bone?
Put it back together.
So when you put it back together, do you want it moving around? Do you want it mobile? Right, so immobilized means you're keeping it all together.
Some fractures are accompanied by soft tissue injuries and require integrated treatment. Mild concussions are often treated with rest, but severe ones can require major medical treatment. Tips for preventing injuries. Athletes can prevent some kinds of injuries by following a few tips before playing sport. Get a physical examination.
Examination.
Yeah, that's what I said. A sports physical can identify potential problems before they cause minor or serious injuries. Many organized sports programs require a doctor's form that confirms an athlete is fit to play. It's a good idea to get checked out before starting any sport, even if the exam is not required. Start by training. Athletes should follow training guidelines to work up to a high level of fitness before playing at full intensity. It takes time to get fit. Different sports may have different training regimens or routines, but most require a mix of strength training and endurance. Warm up every time you play. Student athletes should avoid quick starts. Warm-ups loosen muscles and get them ready to play. Experts recommend a mix of stretches that include holding stretches, such as toe touches, and moving stretches, such as jumping jacks. No pain, no gain. Although the phrase no pain, no gain may apply to healthy athletes who are training, it's bad advice for someone with an injury, whether chronic or acute. If an athlete gets hurt or feels pain or something just doesn't feel right, it's important to stop and get it checked out right away. For some athletes, it may be tempting to try tough it out, but playing through the pain of a sport injury is likely to make it worse. Sure, it can be frustrating to miss a game, but the cost of playing when injured can be high and can result in permanent damage to the body.
All right, excellent. So let's take a look at those questions.
According to the passage, which of the following is the most common sports-related injury? Finger fracture.
What were the options for?
Concussion, sprained muscle, sprained ankle, or finger fracture.
You want to say finger fracture?
Yes.
Okay. Where did you see that in the text? Do you remember?
In the beginning, it said that was the most common.
Excellent. All right, how about the next one?
Which of the following is the best symptom for the word chronic, or synonym for the word chronic as it's used in the passage?
So what are your options here?
Acute, persistent, temporary, or what's that?
Amateur?
Amateur.
So could we narrow these down? These are some tough words. So remember what we said about chronic.
It's not amateur.
Okay.
That's over here. It says that. Temporary is the same as like acute, so it's persistent.
Persistence, excellent. Okay, so temporary is like obviously that doesn't stay for very long, but we said that chronic, it stays for a long time, so it's persistent. That's excellent. How about the next one?
In what way are sprains and strains alike? They're both painless and best treated with rest. They're both caused by significant blow to the head. They both cause permanent damage to muscles and tendons. They're both classified as soft tissue injuries.
Excellent.
Said that I think on page 3 or 2.
Hold on.
How does time spent in training help athletes avoid permanent damage to their body? It allows athletes to make regular medical appointments. It helps athletes build strength and endurance. It helps athletes know they're fit to participate at full intensity. It allows athletes to play through the pain. It helps athletes build strength and endurance. Let me see, wait. How does time spent in training? Yeah. I think it's that.
What was your first option? Which one was that?
It allows athletes to make regular medical appointments.
Yeah, I think you chose the best one.
Which statement would the author of the passage most likely agree with? Athletes at all levels should follow guidelines to prevent sport injuries. To be successful, athletes must learn how to play through the pain of injuries. Teenage athletes do not have to worry about sports injuries as much as adults. There's very little that amateur athletes can do to prevent injuries. The first one, athletes at all levels should follow guidelines to prevent sports injuries.
Excellent. Well done, Karen.